Right, good afternoon, everyone. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Alsobrooks. We have a number of exciting announcements today. We're also going to bring an update in terms of our COVID vaccine response. First we'll hear from the County Executive, followed by DCAO Dr. George Askew.
Good afternoon, everyone. Thank you for being here this afternoon as I give some updates for you on our county's vaccination efforts, including a preview of a new county-wide program that we've launched to encourage vaccinations, encourage our residents to get vaccinated. Afterwards, I will also discuss our efforts in the wake of the tragic shooting of King Douglas, and I'll be giving some updates about what we're doing to keep our kids safe, most especially during these summer months. And finally, I'll have some updates for you on our county beautification initiatives that I think are very exciting, and I want to share those updates with all of you all as well. So since last March, 83,327 Prince Georgians have had confirmed cases of COVID-19. There were 8,427 of our residents who have been hospitalized, and 1,433 members of our community have passed away. And so this has been a most unbelievable year for us, and we continue to pray for and to support all of those who have suffered during this year and who have lost so much. So we're working now to recover, and we believe that the best way for us to do that, of course, and to stop the spread of this very dangerous virus is through the vaccinations. And so I'll be talking about that in just a moment. Likewise, Dr. Askew, who is here and who I would like to thank for his leadership, he has done, and this word is an understatement, a yeoman's job, really in helping us to get through this vaccination program. I want to thank him for all that he has done to represent us both here, and he's worked like all get out on the state level, federal level. I want to thank him for his leadership as well, and he'll provide a more in-depth update on our fight against the illness in just a moment. But of course, before I begin, I'd like to just remind everyone that although we are excited that the vaccine is available, and I reluctantly say readily available, but I think this is true now, that even though the vaccine is available, we still urge you, we are not done yet with this virus. It is still present in our community, and so we urge all of you to please continue practicing social distancing and to wear your mask, especially when indoors. Avoid large gatherings, and then, of course, sign up to receive the COVID-19 vaccine. Today, what we know is that the COVID-19 vaccine is easier than ever to get, and residents can now register for their COVID-19 appointment online at all of our county health department operated clinics. Pre-registration is also no longer necessary. You use our new online appointment portal to do so, and residents and individuals who work in the county can book available appointments for their first dose on the COVID-19 vaccination website. Second dose appointments will be scheduled during the first dose appointment. And I want to encourage all unvaccinated people who live or work in Prince George's County to please, please, please schedule your appointment. You can do this by visiting mypgc.us/proud-to-be-protected. mypgc.us/proud-to-be-protected. Here, residents are able to choose a county-operated vaccination clinic, and you can book your appointment there. If you lack internet access, not to worry, and you still need your vaccine, you can receive assistance by calling 311 and pressing pound. The state's mass vaccination sites also no longer require pre-registration, and to register there, you just go to covidvax.maryland.gov, or you can call for the state mass vaccination sites 1-855-634-6829. Since we are in phase 3 of the vaccine rollout, everyone who is 16 years old or older is now eligible to get vaccinated. I imagine Dr. Askew will mention this as well, but we're still waiting for word whether or not the 12 to 15-year-olds will be soon eligible to receive the Pfizer vaccine. We're hearing that we're very close to having that approval as well, and so that will open up even more individuals who are eligible to get the vaccine. So please schedule your vaccine appointment now. and join the growing number of Prince Georgians who are proud to be protected. We remind you again that your vaccination is not just for you, but it is absolutely for those you love, all of those who are around you. We want to gather safely, and we urge you to do so. We have now a countywide vaccination and distribution education initiative that I want to tell you about. Yesterday, we launched a walk-up clinic for a vaccination site that does not require an appointment. And at the Sports and Learning Complex, we offered 500 doses on a first-come, first-served basis to begin this program. The operation went very smoothly. They do such a professional, wonderful job at the Sports and Learning Center. And I want to thank all of our staff who made that possible. Unfortunately, what I have to tell you is that we only had 160 residents who took advantage of the program, despite the many ways that we pushed this information out to the community. We communicated on every platform we had, urging people to please come to the walk-up clinic to receive those vaccinations, but we unfortunately only had 160 residents who showed up to take advantage. So what we learned is this: demand has not kept pace as the COVID-19 vaccine has become more widely available, and this is an issue that we're starting to see emerge in jurisdictions across the state and across the country. However, we can help bolster demand for the vaccine among county residents through messaging and outreach campaigns, including canvassing efforts and phone calls, and that's what we're going to do. Boosting demand is a top priority for our county, which is why I'm very proud to announce our new county-wide vaccine distribution and education initiative. We launched this vaccine distribution outreach team to canvass Prince Georgians across the county, in person, through messaging, and over the phone. So you know now that we mean business when we say we really do want you to be vaccinated. So do not be surprised if you receive a home visit from us inviting you, please, to be vaccinated. We've launched this outreach team to canvass, and now Prince Georgians have more ways to get vaccinated than ever before. And today we're putting this outreach effort into overdrive to help spread the word. The end of the pandemic is in sight, but only if we get enough of our residents vaccinated. And this is so important. So we're knocking on doors as a part of a broader effort intended to increase the number of Prince Georgians, especially those in areas where the vaccines are most needed. And so the county's vaccine equity team has identified roughly a dozen communities that are priority. And these communities will evolve over time as certain populations gain greater access to vaccines or respond to new messaging. The criteria for this prioritization includes socioeconomic need, existing vaccination rates, and population size of individuals who are over 16. These communities will receive a full suite of remote and in-person contact, and throughout the program we will make 3 passes through each of those groups, canvassing homes in these communities. In total, this program will knock on 266,352 doors, and right now we're performing door knocking in the following communities: Bladensburg, Temple Hills, Capitol Heights, Hyattsville, Oxon Hill, College Park, District Heights, Riverdale, Suitland, Langley Park, and Mount Rainier. We will also reach our entire county remotely via phone banking and text banking. Our comprehensive program will make over 1.3 million calls and send over 500,000 text messages. And so we are looking for you. If you are unvaccinated, that is the point of this story today, is that we just believe so strongly that this is the way forward for our community. And we have one simple goal, and that is to increase the number of vaccinated residents. And in an era of social media, some of the most vulnerable populations we serve are also the most susceptible to misinformation about the vaccine. And so at the same time, our outreach teams will provide residents with important information on COVID-19 relief programs and resources. So we're here to set the record straight. I know Dr. Askew, I'm sure, will speak to this in a moment, and that is that these vaccines are safe and effective at reducing the spread of COVID-19, and they help protect us on an individual level, while at the same time helping us to protect the people that we love. And so it is so important. And now that you don't need to pre-register, this was the bane of our existence, was having to pre-register so many because of the lack of supply. But now, because the supply is catching up to the demand, you do not need to pre-register for vaccinations. So this means that our Canvas teams will be able to help residents register for the vaccine when they meet at the door, or even over the phone, if we are able to reach them that way. And so we're trying to make it easier than ever to get vaccinated. And our outreach team is playing a critical role to ensure that our community is aware of this. So please help us spread the word about this. And really, there really just is not enough that I can say about how is important it is for us, please, to get vaccinated. Whatever information you need, if there is confusion, fear, concern, whatever it is, we are so happy to answer those questions. But please do check in with the people you love. Don't take for granted that the people around you have been vaccinated. There's no reason now. There are no barriers now. They are available to everyone 16 and older at this point. So if you please check in with your neighbors and loved ones, just take a moment to ask whether they have been vaccinated. And if they have not, we have the outreach teams who are going out, but also call 311. We really feel this is so important to keep us safe. Now I want to move on to another topic that is a very, very serious topic as well. And this is regarding the King Douglas shooting death, and to talk about what our response is as a community. It is important for us to, during this COVID-19 crisis, what we know is that it has created not only for us a public health crisis, but it's also created a different type of crisis. And that is a crisis among our young people. And anyone who has been within earshot of a child understands how difficult and devastating this last year has been for them. The sheer isolation, the depression. Our kids are really struggling, many of them are. With the distance learning, it has been difficult. And so it is important for us to take care of our needs, but we cannot forget to take care of the needs of our children. The month of May, you should know, is Mental Health Month. It's especially important for us to check in on each other and just see how we're doing. Again, just like I'm saying about the vaccine, please check in and ask the people around you how they're doing, and like really mean it. Look at a person, ask them, how are you doing? And then wait for them to respond and find out how they're doing. And so we know that the hardships have been great. And in particular, this week is also Children's Mental Health Awareness Week. And as we look for ways to step up for our children in the wake of the tragedy that just occurred, is so important that our kids know that we will take their childhood experiences important, because their childhood experiences are experiences that they will carry with them into adulthood. We know now that we are still grappling. There's really no way to understand from a logical standpoint how it's possible for someone 12 to shoot another kid who's 13 in the back and kill him. It's just, no matter how many times you spin that around in your mind, there's nothing logical about it. In fact, it should be impossible. But it did happen. We know King Douglas was just a child. And we also know that the person who killed him was a child. And so we gathered recently for a candlelight vigil to honor his life. And what I said on that day is the same thing I say today, is that the fact of his death does not reflect on the children who were involved. It reflects on the adults in this community. It does. It does not say anything about King Douglas and about the child who killed him, but it does say something really strongly about the adults of our community. And that's the reason that we are responding. We believe that our children serve as mirrors, and what they mirror is what we give them. And so the death has landed hard on the soul, I have to tell you, of mothers, fathers, brothers, sisters, grandparents. It has landed hard on my soul. There's nothing, I think, as moving and transformational as the death of a child. And King Douglas's death, I can tell you, is one that we all took to heart. And so we're really acting because of it. We have been compelled to act. And so what we're doing now is we have talked not only to our kids, and the feedback that they have given us, I have to tell you, is not great. When we think about what their actions tell us, not necessarily what their words say, but what their actions tell us. We have crimes involving our children are on the rise across the region and in the nation. In 2019, for example, juveniles in Prince George's County were involved in 15 carjacking cases, and 7 homicides. Then we know in 2020, it was 49 carjacking cases and 7 homicide cases. And so far in the first few months of 2021, we've already had 13 carjacking cases and 4 homicide cases. And so tragedies like this, again, should not happen. And so we're gathered here and we're going to stand up and say that we will not allow this to continue to happen in our community. This is not a reality that we accept. In fact, I reject outright the reality that any child in Prince George's County should ever lose their life on the street at the hands of another child or at the hands of any person. I reject it as a reality. And so there has been so much disruption, what we know, is to our kids' routines. And studies have shown us that access to summer youth employment programs, as well as after school and summer recreation programs, help our kids from getting into trouble. And so we want to make sure that our youth are learning and doing while achieving a sense of belonging in this community. And we all need to work together to ensure that we provide positive experiences for our children. We won't leave it to anybody else. It is our responsibility, not just as a government, but I just want to also say, I'm going to outline in a moment what the government is doing, but I also want to be abundantly clear that this is a community responsibility. So if you see children who are somewhere in your neighborhood, let's work together, please. The government is going to do its part, and I'm asking, urging all those in our community who are able to step forward and help us in partnership to provide those opportunities for our children. It's on us to provide structure that supports positive goals. Many of the changes that we're making will include increased access to existing activities and programs for youth. And every summer, we're going to work to provide school-age kids with a number of opportunities to participate in sports, the arts, theater, and other programs to pursue a wide range of interests. And it's not just school age. Our summer youth enrichment program, we have extended the age. It goes up to 23 years old. And so we're going to continue to make sure that we're also working for those kids who have been disconnected. And so what are we doing? The Prince George's County government, in partnership with the Maryland National Capital Park and Planning Commission, the Department of Parks and Recreation, will offer under the lights an outdoor teen-based sports programming across the county this summer. I do want to say thank you so much to Elizabeth Hewlett, who is chair of Maryland National Capital Park and Planning, and her entire team. I reached out to say, we need you please to provide us with a menu of what you will provide and how you can expand it, and they did not hesitate. They jumped into action. I also have met with Dr. Monica Golson. I want to thank her. I've met with Roberta Phillips at our library system, and so we are all working to provide what we can for the summer. Look out for additional announcements in this regard, but we have been working ahead of time to make sure that we have plans for our kids through the Recreation Without Walls program, which will begin after Memorial Day weekend. Basketball skills challenges, pickup flag football, and soccer will be available for teenage residents at our park locations. Teens interested in participating will need to complete a one-time registration through the department's Parks Direct registration system. And with this one-time registration, teens can check in to any of our program offerings all summer long, and we intend to offer these programs during the evening hours so that participants can beat the heat and also have an opportunity to have a planned activity to do during the evening hours. And so we're going to extend the hours so that our teens have it. In addition, all basketball hoops will return to courts across the county by the end of this week. And through the Alsobrooks Summer Youth Passport Experience, youth ages 12 to 18 throughout the county will have a variety of safe and fun options to choose from this summer. The Passport program will operate from June to August and will offer a number of day and evening events that will start daily at 9 a.m. And I want you to know that these events will go through midnight. We want to include engaging activities for our youth that cover the 3 E's. Education, entrepreneurship, and experience. Again, that's the 3 E's: education, entrepreneurship, and experience. And we're happy to announce several confirmed strategic partners, and we're adding and always looking for more for this new program, including the Maryland National Capital Park and Planning Commission, the Office of Community Relations, AT&T, Tanger Outlets, the Prince George's County Police Department, and a host of other businesses and organizations in our community. And so we want all the young people in our community to participate in safe activities that occupy them physically and mentally while being able to socialize in a safe and supervised setting. The Prince George's County Department of Parks and Recreation already has a number of ways for young people to get active. I want to mention a few of those. Many of our fitness facilities have reopened, including county fitness rooms and gymnasiums. Right now, residents can make appointments to visit our gyms online. Our nature centers are open as well for self-guided tours. Waterfront parks are open, as are several of our arts centers and the Prince George's Ballroom. A full list of these open facilities and a link for appointments can be found at pgparksdirect.com. That's pgparksdirect.com. And for teens interested in volunteering this summer, a full list of volunteer opportunities and signups is also available at pgc.samaritan.com. And so starting this week and over the coming 2 weeks, dozens of programs and services will open up for our youth. For example, teens ages 14 and up can now make reservations to use indoor pools. Community Arts is running a junior academy for the performing arts. And free yoga in the park is happening every Saturday in parks across the county. Along with these programs, soccer, basketball, baseball, lacrosse, triathlon, rowing, chess, video game tournaments, and a host of other sports are happening in the county and across the county all summer. And while recreation is important, we are also offering courses to our teens as well. And so our kids can earn their lifeguard certification, complete a workshop in gardening or writing, meet new friends, and so much more. So we encourage teens and parents alike to visit pgparks.com, where they will find a full list of the summer program offerings. And we're renewing our focus on these programs again, because I believe that it is on us as a community to make sure we create a safe space for our children to gather and grow together without winding up on the wrong path. And so finally, I have some more good news. I've been hearing a lot about the county, hearing from a lot of you who are concerned and want to continue to keep our community beautiful. And so over the past few months, we've renewed our focus on beautification efforts across our community. And I have to tell you that it is just so heartwarming, and it makes me feel great that, that so many of you are now reaching out to ask also what we can do together as a community. It tells me that we believe that we're moving slowly on the other side of this pandemic. And so we help to make the environment in our county an even better place to live. And so this past Saturday, I want to thank all of you. We had such a strong turnout for Growing Green with Pride Day, a community cleanup, where we had hundreds of volunteers sign up to make our county sparkle. We had more than 80 groups and 1,372 volunteers, including 3 municipalities and 9 schools, come out, and they came all out to clean up and to beautify our community. I was out there and enjoyed seeing you all so much. The spirit was so wonderful, and I was so proud to be alongside so many of you this past weekend. It's just amazing. And so our preliminary total for those who participated and those who were not able to for Growing Green with Pride Day is 49.7 tons of trash that we collected this past weekend. That's 99,400 pounds of litter and illegal dumping that our residents work together to remove. And our community works best when we work together, and we're not going to stop. We know after one successful cleanup. This Thursday, in fact, our litter task force will have its first meeting, and we will consider ways to keep our momentum going on litter and illegal dumping. And our task force will discuss our ongoing communications campaign also to let residents know how they can get involved. And the task force will also discuss ways to expand our illegal dumping camera program, where we're going to catch illegal dumpers in the act. I keep telling you to let the people know we have our eye on them through these cameras that are fixed, that are mobile cameras that we can move around the county. We're also exploring ways to create an interactive dashboard for residents interested in litter removal. So I want to thank again every Prince Georgian who volunteered their time this past Saturday. It was meaningful, it was impactful, it was important, and we really appreciate the work that you're doing to make Prince George's County more beautiful. So overall, we have made tremendous progress in our fight against COVID-19, but we still have a long ways to go before we can fully move to the other side of this pandemic. I can't say thank you enough to Prince Georgians who have sacrificed, who have really done everything you can to take care of each other. Thank you for your diligence. And just thank you also for your patience. And so I thank you also for participating to help us get our kids registered for one of our very exciting summer experiences and programs. Let's make this a great summer, everyone, as we continue to heal not only our bodies, but we are also continuing to heal our community. So we thank you so much, and I'm going to hand it over now to Dr. Askew.
Thank you, Madam County Executive, and thank you for your vision and your leadership. As a pediatrician, I'm particularly inspired by what you have planned for our kids this summer. I think it was a stroke of genius, and I'm really excited to support you in all those efforts. And good afternoon to all of you this afternoon. I want to say that Prince Georgians have helped the county and the state of Maryland make great strides and great progress on our journey to reopening. Vaccinations in the county reach new milestones each week, and our COVID metrics are getting better every day. Prince Georgians should be proud of their role in making public health history. We are taking care of each other when we need it the most. The light at the end of the tunnel is getting brighter, and now let's end this dark chapter for good as a family. I'll begin with an update on the virus in the county. New weekly cases are on the decline. In fact, the county has seen an over 70% decrease in weekly cases since the start of 2021, when we had 3,700 cases in the first week of January. For the week ending April 24th, however, there were 978 new cases. It was the first time since mid-March that we were under 1,000 new weekly cases. Final data from last week is still coming in, but we anticipate a second straight week of fewer than 1,000 cases. This decrease also means that our daily case rate has declined to 13.7 new cases a day per 100,000 population. It's still a bit of a high number for us, but we have trended down for 2 weeks consecutively, and I think we're going to continue heading in that direction. As for our positivity rate, which I know a lot of you are also following, the county is in the low 4% range. Right now we sit at about 4.3%, and we have stayed below 5% for more than a week. The county's infection rate, or how often COVID spreads from one person to another, is below 1. We are now at 0.91, which means a person infects fewer than one other persons in the county on average. Our goal is to be below 0.9, which is considered low risk for community spread, and we are getting closer. And in fact, at one point in the last week, we did drop down to 0.89, so we're sitting right there. I'm also encouraged by a decline in hospitalizations. At last check, there were 113 people in county hospitals due to COVID-19. We have stayed below 150 patients with COVID in the hospital for over a week, and thankfully, our hospital capacity is still in great shape. Half of our beds are available thanks to surge capacity hospitals put together since the beginning of the pandemic. We are watching for all of these declines to keep going and pick up more speed, as well as stay safe and as more people are vaccinated, as we all stay safe and more people are vaccinated. Approximately 1/3 of the population 16 and older is now fully vaccinated. Nearly 50% have received at least one dose so far. Again, nearly 50% of our 16 and older population in Prince George's County has received at least one dose so far. And the county is closing in on 600,000 vaccine doses administered to residents. That is truly an outstanding effort and accomplishment. The county is only behind Montgomery and Baltimore counties for the most first dose vaccinations given in the state so far. Vaccinations and improving metrics are allowing capacity limits to change for the better in Prince George's County. And based on CDC recommendations, the county is taking another step forward by lifting its outdoor mask mandate. As a reminder, fully vaccinated people no longer need to wear a mask outside when they are walking, running, hiking, or biking, or when they are in small gatherings with people they live with, or when they are with other fully vaccinated people. Everyone, no matter the vaccination status, still has to wear a mask indoors and at all large, crowded outdoor events. We strongly encourage unvaccinated people to continue wearing a mask outdoors and indoors, and even more strongly encourage you to get vaccinated. All of this still means we have to maintain social distancing, avoid crowds and travel, and wash hands as much as possible. Those things have not changed. Lifting the outdoor masks mandate is something to celebrate, but we are not done. We are not done by a long shot. Let's get to the place where we can shed our masks no matter where we are. Getting vaccinated and staying safe are the keys to unlocking the world and a better, safer future for us all. We encourage anyone 16 and older to get vaccinated, and it has never been easier to get it done. This weekend, we are extending hours at the Sports and Learning Complex, the Laurel Beltsville Senior Activity Center, and the Southern Regional Technical Recreation Center in Fort Washington. These sites will offer vaccines from 9 a.m. to 8 p.m. this Friday, and then we will have a special weekend hours on Saturday and Sunday at the Sports and Learning Complex from 9 a.m. to 4 p.m. We are encouraging our teenagers to come and get the shot. If you are over 16, schedule your own appointment at mypgc.us/proud-to-be-protected. If you are 16 years, if you are 16 years or 17 years old, you also must have a parent or guardian with you at the clinic to fill out the consent form. And as you've probably heard and the county executive alluded to, we may very soon have the ability to vaccinate children as young as 12 years old. So please stay tuned. All county-operated vaccine clinics are self-registration, so no more pre-registration. All you have to do, again, is to head to mypgc.us/proud-to-be-protected. Once there, you'll schedule your own first dose appointment, and you can also call 311, press pound, and someone will help you get that appointment scheduled. Your second dose will be scheduled during your first visit. The state's vaccination sites also no longer have pre-registration. You can head to covidvax.maryland.gov or call 1-855-634-6829 to get an appointment scheduled. In addition, more pharmacies, hospital systems, and doctors' offices across the region are getting more vaccine to give out as well. I want to emphasize that while we're coming out of the pandemic, or what seems like we're coming out of the pandemic, to make sure that everyone understands it's not over. Don't neglect getting the vaccine. Every vaccination counts. Every vaccination counts. The more people who get the shot, the harder it is for the virus to spread from person to person. The vaccines provide the know-how for our bodies to piece together information to master the virus. The vaccines are most importantly protective against serious illness, hospitalization, and death. They provide excellent protection from getting even mild to moderate symptoms. Based on FDA and CDC review and clearance from the state, the county will also resume the use of single-dose Johnson & Johnson vaccine as it becomes increasingly available to us. As you may recall, the vaccine administration was paused while the FDA and CDC reviewed the occurrence of a serious but very, very rare blood clot that had been reported in 17 recipients out of the more than 8 million people in the U.S. who got the Johnson & Johnson shot so far. The FDA and CDC have determined that the risk of COVID far, far outweigh the risk of receiving the vaccine, and we agree. As a medical professional, I know it's critical. I know how critical it is to be transparent. Patients and parents and families need to be aware of the potential negative outcomes, even if those outcomes are very, very, very rare. Patients also need to know that unvaccinated people are much more likely to get sick or die from coronavirus than to get a severe complication from a vaccine. So I continue to remind you, the best vaccine is the one that's available to you first. As an additional reminder, feeling side effects from vaccines for a day or two is also normal. So don't be surprised if you feel a little achy or tired following your shots. You may also get some nausea, and you may get a slight fever. Finally, I just want to thank Prince Georgians for looking out for each other and following the precautions that we know work. Thank you for being proud to be protected. I urge your loved ones to be part of this historic humanitarian effort to protect each other and move forward as a healthier and stronger people, a healthier and stronger Prince George's family. Thank you.
Okay, and with that, we'll take any questions. Tracy?
So you are absolutely right. We are in Prince George's County in a period of reformation. And that reformation that you're seeing in our police department, it mirrors what is happening across the country. So you've noticed that I have been very intentional about making leadership changes and some policy changes. Now those policy changes and leadership changes have been going on now for about a year. As you know, last year we put in an interim police chief and began a search for our new police chief. Also designated a group for a police reform task force. And that task force brought us back recommendations in December, and we are actively implementing those recommendations. And you know what, the truth is this. I have said over and over again that as I saw things, I would act on what I saw and make decisions that are in the best interest of this community. And I have felt that, you know, the changes that have been made as of late and throughout the year have been in the best interest of the community, including the leadership changes that you saw. And so I've changed the entire top of that leadership change. We're really looking forward to Chief Aziz, who will be here on May 9th. I will also be introducing next week a new public safety director on an interim basis. And so I will continue to not hesitate to make whatever decisions I believe are in the best interests of our county and our department. And so you'll look to see leadership changes, policy changes, and I believe that the changes that we're making now will absolutely make us better, stronger, and more responsive to our community. Well, the resignation, I did request the resignation of Chief McGaw because I felt that it was in the best interest of our county. I felt that we needed a leadership change. I am very dissatisfied with the things that I've seen occur in our department. I've made no bones about that. Very, very dissatisfied and very concerned with some of what I've seen, and I thought a leadership change was needed, and so I've made it. So, you know, I believe that the task of keeping our children safe is a community responsibility. The government has a responsibility, which I've outlined today, what our responsibility will be in this and the activities that we will make available. And you're right, parents are our best partners in keeping their children safe. It should not be the case that a minor child is ever dropped off someplace in an evening unaccompanied. It's inappropriate to do so. It's dangerous to do so. And so we urge parents, please not to drop off your minor children at these locations and expect them to manage themselves. It's dangerous for us to do that. And so we have created activities now to make opportunities more available to parents. Because you know what? I'm a parent. I get it. My daughter is 15. All of our kids want things to do. And the truth of the matter is, which is why you don't see me blaming parents. I'm working to be good partners to these parents. Because in our community, the truth is that there have not always been enough activities. It's been difficult sometimes to find activities that are constructive to engage our children. Everybody's searching for positive and constructive things for our kids to do, and we're going to do our part to make sure we're providing those. And we do ask our parents, please, ma'am, please, sir, your minor child should not be dropped off at some location and left there to 10 o'clock at night, midnight, whatever the case may be. It is unsafe for them, and it's not in their best interest.
On the vaccine beat today, some of the folks we as reporters spoke with in the field said, you know what, the seniors are on board. Now it's really a younger cohort, 25 to 35s, that perhaps this outreach wants to touch. I don't know if that's the case. What do you think?
I think that this is true. I think our seniors were very motivated to get vaccinated, and we were so thrilled about that because, quite frankly, our senior population was the one that was hardest hit. I think that some of our younger residents are now getting vaccinated, and some of them do need our encouraging and urging. We have an effort also that we're undertaking now to make sure we're addressing the vaccination in men. We have a whole program with the Commission on Fathers, Men, and Boys to specifically attract men to get the vaccine because we have we've noticed that there's about a 30-point difference between men and women in our community who are getting vaccinated, and we want to encourage the men in our community to protect themselves as well. And Dr. Askew, I don't know whether there's anything else you want to say about the young people and the vaccination rate.
Well, maybe I should frame a question for Dr. Askew, and it would be, you know, what we hear anecdotally is, well, I'm going to wait and see. I saw some stuff. I'm not sure. I'm going to wait and see. What's your answer to I'm going to wait and see?
Well, I think this has happened in phases. We had initially we had the early adopters, folks who couldn't wait to get the vaccine and jumped right on board, and we had folks who really put a demand a pressure on the supply. Then we had the folks who were the wait and sees, right? They're going to get the vaccine, but they're just going to wait and see what happens. So we started reaching those folks and probably have gotten through a good many of them. Now I think you have the folks that are the come and talk to me and tell me why I need to take this vaccine and bring the vaccine to me. And I think that's the crowd that we're reaching out to now. That's the crowd that we're really pushing forward with. It's the really come and talk to me crowd and bring me the vaccine.
A couple of quick questions. If you were out there knocking on doors, what would you say to the lady who told me today, I still just want to wait and see? What would you say to the people?
See, you don't need to wait and see anymore. We're done waiting and seeing. We have plenty of information, and anyone who needs the information. And I say that to be humorous because my mother told me this same story when I originally approached her about the vaccine. She said she and her cousin decided that they were going to wait another couple of years and see how things played out. I told her we didn't have another couple of years, and I understand the reluctance. But now we know that so many have received the vaccine and have done so safely. And we're able to see the evidence of it, that it is working. And so we want everyone to feel encouraged that these vaccines are safe and effective at preventing the spread of COVID-19. And we're hearing also that in the very, very small percentage of individuals who can still get COVID, that it does protect at 100% against hospitalization and death. So there is every reason in the world to get the vaccine and very few not to. I've not seen any reason at this point from the medical professionals and the scientists that there's a reason to wait, but there are many reasons to do it now, including the fact that the vaccine is not just for you. We have Mother's Day coming up. We have all of these wonderful occasions. We want people to be able to gather safely without concern that they may harm someone else. And so tell her, come on, we're waiting. We'll keep the porch light on for you, and we have the vaccine is readily available.
Yeah, the governor announced yesterday $100 to state employees that'll take a shot. West Virginia's kind of doing the same sort of thing. Have you considered to get to that last little cohort that's going to be hard to get any sort of a carrot or the stick approach?
We are, many carrots. We're out and about. We're actually going to residents. Whether we have any money to give them yet, well, you know what? There's a guy named Stan Early, who I'm sure is listening to this right now. And in fact, I'm meeting tomorrow with the bond rating agencies from New York who help us keep our perfect credit score. So we're going to make good fiscal decisions about this, but we're not going to spare any effort in getting out to vaccinate our residents.
Go ahead, Will.
Dr. Askew, quick question. And then I have one more. Kind of touch on Scott's question in regards to trying to get those last batch of residents. This who I talked to who still haven't got vaccinated. But they're happy to get vaccinated. However, said it already, but to stick to the point that it's safer to get something like that than not.
Yeah, again, the point being that the best vaccine for you is the vaccine that's available at the moment you're offered a vaccine. Getting vaccinated itself is life-saving. The county executive touched upon this. This is a life and death measure, right? Getting vaccinated saves lives. Not being vaccinated puts your life at risk. And so I would say to folks who are hesitant to do that math, do that calculation for yourself. But also we have to do our job and make sure that we are making available to folks opportunities. And there's a lot. Again, I almost want to say if you don't have a vaccine now, you're not trying, because there's so much vaccine available to folks, as our ability to even offer up walk-ups and offer up the opportunity just to walk up and we'll vaccinate you for that one trial. We may do it again if we prove that if we can see that there's a demand for such an activity. But it's life-saving. It's life or death.
This is my final question. The county council, county council passed a resolution on healthcare for all. And do you see that this could connect to COVID-19?
Always. Generally speaking, of course, anything that we can do to improve the status of folks coming out of the pandemic, making sure that we're looking at not only healthcare for all, but health policy, health and all policy issues, where you look at all issues and say, how does this impact the health and well-being of a community, is critical to where you end up down the road when it comes to the next pandemic, the next disaster, the next environmental disruption that's going to lead us to a situation where we'll have to rush to make people safe and well.